In a second. Hi, good afternoon, everyone. Welcome to our broadcast today. My name is Lori Kelly, and I'm really excited. I'm your host today. I'm the Group Vice President and Chief Financial Officer at Providence. And with us today, we have our esteemed colleague, Dr. Lori Tam. And I'm really excited to get into some questions with Lori in just a second. But as we always start out, we want to remind you that the information on the broadcast today is for information purposes only. For any medical questions, please reach out to your primary care provider or a health professional. So now we're going to begin, and joining us today live, and we're really lucky to pull her away from patients for half an hour here, is Dr. Lori Tam, and she is the medical director of the Women's Heart Program at Providence Heart Institute. So welcome, Lori. How are you?
I'm well. Thank you for having me today.
It's great to have you, and so great to be able to share some heart tips in Heart Month, and especially about women's heart health. And so first, before we get started, could you tell us a little bit about your role at the Providence Heart Institute?
Yeah, so while I lead the clinical programs in terms of the Women's Heart Program, I have expertise in the areas of treating heart disease in women. I'm a general cardiologist, but I really see a lot of women patients, and we take care of a lot of issues that are specific to women and heart disease. In addition to my clinical role, I also lead some educational initiatives and community outreach programs through Providence, especially through Base Camp, which is our cardiac wellness and prevention center. Every month for the last 3 years, pretty much, I've hosted a women's tea and talk on the first Tuesday of the month, which is really a community program for women in the community, where we talk about different topics related to heart health. We do interactive activities like cooking demonstrations and yoga classes and meditation, and really kind of combine wellness with women's health and heart health. We have guest speakers that come in and provide us with different topics every month, related to women's health, like menopause, or how do you start exercise programs? What is a good nutritional kind of content in terms of meals and things like that? So really just great tools to hopefully help women and their families live a heart healthy life. I also do some research work. So I am the principal investigator for the ISCAD registry, which is the International Spontaneous Coronary Artery Dissection Registry. It's a type of heart disease or type of heart attack that happens much more commonly in women. So we have great programs here at Providence, and I'm excited to be a part of it.
That's great. You do such an amazing job, and you're just such a great friend to philanthropy too. You've taught us so much, and we are often bringing Lori on visits with us to talk to donors that are really interested in how they can help improve heart health, because so much of the research and things that we do, like Base Camp, are really funded by philanthropic dollars. Are a lot of the classes at Base Camp, are they free?
Yeah, actually, the vast majority of our programs are free to the community. And, we had to kind of pivot to a virtual format for many of our programs after the pandemic. But, before that, we have a great yoga studio here on site at Base Camp. And we offer yoga classes several times a day, Pilates, Tai Chi, meditation, a lot of interactive activities for the community. And the vast, vast majority of them are free. So I have, some of my patients that say, well, I've had a stroke, I have balance issues. I really wish I could do something to help with that. And it's like, well, we've got Tai Chi downstairs several times a week. It's free. Join us for that. But since the pandemic, we actually offer many of these classes virtually. So if you go to our website, which is www.welcometobasecamp.org, you'll be able to click on a link. There's a great schedule of all the free offerings that we have pretty much every day of the week. We have weekend classes too. So it's free to the community. Anybody can participate. You don't have to be a patient of Providence, actually.
That's great. Great. So Lori, you could have decided to be a doctor in any field. You've done a lot of other jobs too. Why the focus on women and heart?
Yeah. So, I've been taking care of women for a long time. So dating back to my days as an internal medicine resident at Brigham and Women's Hospital, which is part of the Harvard system in Boston. Even back then as a young resident, my primary care clinic in internal medicine was in a women's health center. And so I've been taking care of women for a long time. And I think that, we tend to treat sometimes women as kind of just smaller versions of men, which is not true in medicine and not true in any way, really. But, because we haven't really kind of focused our care of women over the years, sometimes there are things that get lost. I think people don't realize that more women than men have died from heart disease pretty much every year since the mid
Wow.
1980s. We think of heart disease as a man's disease, but it's a women's disease. And some of that is because over the years we were not as aggressive in terms of diagnosing heart disease in women. We didn't treat their cholesterol as early. We didn't treat their blood pressures as aggressively. And they end up having more heart disease problems later on. So I think that there's so much more to taking care of a woman, but really kind of having that knowledge base and also that true interest in taking care of women really kind of helps us provide better care. So, I love cardiology, and I discovered that I think as a first year intern when I was at Brigham, and I spent a lot of time taking care of patients in the cardiac ICU. And cardiology, it moves fast, and I think it requires you to think critically. You have to think on your feet. There's a lot of problem solving and critical thinking that has to happen very quickly. But I also feel like it's exciting for that reason, right? It's also very gratifying because you can, take a patient from, who's severely ill or whose heart is actually stopped and they're clinically dead, and bring them back, resuscitate them, and still help them live a normal life, right? So I think for that reason, cardiology is still exciting to me to this day, 15 years later.
Yeah, it's one of those fields that I've been working in healthcare for a long time, many years ago, and then kind of left here, came back, and I feel like it's one of those areas that has really expanded, and so many interventions that are not surgical, and all of that has come with the advancements in cardiology, and Providence Institute is one of the top places to go for those kinds of treatments. So talk a little bit about the differences between men and women. What should women be looking, when they're talking to their primary care doctor, or when they're feeling any kind of pain or anything like that? What kind of signs should women be looking for?
Well, heart disease presents sometimes very differently in women, and that's why it's one of those things that's been under-recognized for a long time. Women may get chest pain, but they may not always describe it as pain. They often might say it's a pressure or a tightness, some sort of discomfort sensation, but they may not use the catchword, which is chest pain. Sometimes women have shortness of breath, and that is kind of their main symptom when there's something going on with their heart. They may notice that more than they would any chest discomfort. But, I think that if there's anything that really is out of the ordinary, it doesn't feel right. And especially if it's worse with activity or exertion, or the more you do, the harder it is, the more the symptoms are prominent. That's something to pay attention to. Women get heart disease. We tend to get it about 10 years later than men. And it's because we have the natural protective effects of our own estrogen until we start to lose it. So, as a woman goes through menopause, a lot of changes happen in the body, but a lot happens in terms of heart as well, the heart, because we start seeing cholesterol numbers go up. It's harder to lose weight. Our metabolism slows down. And when you see all those things kind of increase, you also start seeing heart disease go up as well, which is why women get heart disease. We just tend to get it a little bit later. But if we get it later, we're also older. Our ability to recover is harder. We also tend to sometimes wait a little too long to present. They've done lots of studies. Women who have come in with heart attacks because they're having chest discomfort or something, men present much faster. They call 911, they go to the emergency room. Women wait it out longer. Maybe because we don't recognize the symptoms. Maybe we, put the other things in our lives, our family members first, and we sometimes have to take care of things before we go to the emergency room. I had a woman who was in the process of preparing Thanksgiving dinner, started getting chest pain. And she decided she had to finish making dinner essentially before she so women present much later, and when you present later with a heart attack, your ability to recover is much, much worse, because in cardiology we say time is myocardium, which is time is heart muscle. That's what it means. So sometimes, if you're in the middle of a heart attack and you delay presenting in treatment, the heart gets irreversible damage, and you end up with congestive heart failure and lots of other downstream kind of manifestations that really wouldn't have been otherwise. So I think that, first and foremost, I think we have to be advocates for ourselves, and recognize that if something is not right, I need to get it checked out.
Yeah. And you mentioned just a second ago about rising cholesterol. And even as I've aged, my cholesterol used to be really low, and healthy and exercise, and my cholesterol is rising. And so how often should you get that checked, and when should you be concerned?
So I think, beginning at age, like a young adult, age 21, you should get your cholesterol checked at least once every 5 years. But if you've got elevated numbers, probably every year, every 2 years, at most. But if the numbers are elevated, you really need to know where they're going and whether any of the lifestyle changes you're putting into place is making a difference. Because I think for too long, we kind of let the numbers go for too long, in women, where we say, well, they're a little high. Let's just work on diet and exercise. You say that 1 year, say that the next year. But eventually, you've got to treat it, because if you don't treat it, we're going to end up with blockages in the arteries. People end up with strokes and heart attacks. So I think that at least once a year, I would do it once a year if your numbers are elevated, or at least have that conversation with your doctor every year about it, so you know what you should be doing. And if it's not getting to that point, think about what avenues you need to do to kind of further assess your risk.
Great. And, looking at prevention, and we say at the heart, 80% is preventative, correct? I mean, a lot of people do experience heart problems that might be hereditary, but for 80% of it, those are things that you could avoid. About some of the prevention and wellness that we should incorporate into our lives to have a heart-healthy lifestyle.
Yeah. So we do say 80% of heart disease is preventable by what you eat, what you do, how you live. The other 20% is genetics and luck, which we can't always control. Things that you can control are immense if it's 80%. So I think number one, I think we have to be active. We have become a much more sedentary kind of society over the years. If you look at heart disease numbers and deaths, kind of beginning at the turn of the in the 1900s, so 20th century, very few people were dying from heart disease. It was infectious diseases. We didn't have great antibiotics, public water, all those things. As we changed as a society, we became more industrialized. People left the farms. We became less active. We took on more sedentary jobs, and then our diet changed. We started seeing heart disease numbers rise in 1920s, 1930s, 1940s, kind of peaked in the early 1970s for the most part. And at that point, our technology started to catch up, right? Medical science got better. We knew that there were certain medicines that can help decrease heart disease, control cholesterol. Our technology got better. We had stents and bypass and kind of these great interventional techniques that can change outcomes. But at the end of the day, it's how we live. So I think that maintaining enough activity in your daily life so that you're getting that kind of aerobic activity is important. We recommend at least 150 minutes of moderate aerobic activity a week. So, about 30 minutes, at least 5 days a week. If you want to lose weight, you're going to have to do more than that, but that's a minimum.
Yeah.
And, it could be as simple as making sure that you, walk a couple times a day, maybe at lunchtime or after dinner. It could be taking the stairs, instead of taking the elevators. It's about kind of incorporating activity into our lives so that it becomes a part of how we live. I think secondly, we talked a little bit about diet. I think that there's we don't eat as well as we should in general, because we've kind of moved to a society where there's a lot more processed foods. Things are prepared, they're less fresh because of that. It's convenient. We all live very busy lives now. I think that oftentimes women work outside of the home and we manage the home. So, that there are things that are a lot more on our plate now than there were decades ago. And but because of that, I think people have adopted these things that are good for convenience, but not necessarily the best in terms of wellness and heart health. We recommend mostly like a Mediterranean type diet, or you're eating good fats. The good fats include olive oil and fish and nuts and avocados. Those are good fats. You can have more of that. But less saturated fats and less processed foods. So less red meat, less high-fat cheese, high-fat dairy, sticking to the skim or 1% version of these things if you can. Nothing that's really deep fried or overly processed. So I would say white meat chicken is fine. White meat turkey is fine. Vegetables, whole grains. We eat a lot more sugar and carbs in our diet, especially simple carbohydrates, than we have in years past. And, I think that when there's an option of choosing anything that is white and processed, you always want to choose the multigrain version, right? So, multigrain bread, not white bread, limit the sugar, limit the sugary drinks, kind of those things that it's habits that we have to not just teach ourselves, but also lead by example in terms of our children.
Yeah. At a former job, we actually brought in the author Michael Pollan, who's written quite a few books about eating. And first thing that we did, I picked him up from the airport. We went straight to the grocery store and we shopped. So for the food that he was going to talk about that night in front of 4,000 people. But he said basically you should not shop in the middle of the grocery store. There's hardly anything in there that's actually food. So it was kind of interesting. I feel I hear a little bit of typing on the line. Anybody here typing? Okay, maybe it's just me. Anyway, he was he was just saying shop the perimeter of the grocery store, and that's where all the fruits are, the dairy, and vegetables, and then you may not need as much from the middle of the store. I just thought that was really interesting, and after that evening, I had to come back and look at my own cabinet. Busy mom with 4 kids, and thinking, oh boy, what am I serving? Really tough. So, just kind of something that it's easy, but in the end, is that what we should be doing? We need to figure out how to cook more fresh fruits and vegetables and lean meats and those kinds of things. So what are the biggest things that we should avoid as, from an early age to, getting older?
Yeah. Well, I think we always need to be advocates for ourselves. And I think that starts with being aware of your risk factors, right? We need to know our numbers. And I think that women sometimes don't realize they're at risk if they don't know they're at risk. And so I think that starting early, you should have these conversations with your doctor about kind of what's my risk for heart disease? What are things that I can improve to reduce my risk going forward? And that includes knowing the key numbers, which are really key indicators of your risk for cardiac disease. And that's knowing your blood pressure, knowing your blood sugar, knowing the optimal weight you should be at, knowing your cholesterol numbers. These are basic, but it starts there. They're really the key predictors of how well you'll do in terms of your cardiac risk overall down the road. So I think being empowered is important. I think that maintaining an active lifestyle as best we can is important. I think managing stress is important. We know that heart disease is very much tied to stress. People who have high stress levels, they get more heart disease. And when they do, they have worse outcomes. And I think we need to, in modern society, especially in the middle of a pandemic, I think we all can do a little better job of trying to make sure that we take care of ourselves and our mental health. I think that there are steps that we can always take to kind of improve the health of our families. I think we've made great strides in terms of decreasing the amount of smoking that we now see in society. People, that public health campaign really has done an amazing job. We're seeing people that are much fewer smokers than we have. And that probably has also impacted kind of the rates of heart disease and strokes that we've seen in the past, couple decades. So I think that these are kind of healthy lifestyle choices that I think we need to make all the time.
Well, and I have heard recently we're all, on Zoom all day, that, sitting is the new smoking. And so just taking that time. And I know at Providence, we've really asked people to think about, do you need to meet for a whole hour? Can you meet for 30 minutes? Can you meet for 50 minutes? Don't schedule meetings that are an hour. So you have 10 minutes to kind of walk around, get a glass of water, take a little bit of a break, because people are in meetings like 10 hours a day. And so for you, you've got 3 children, you're a physician, you're so busy. How do you reduce your own stress?
Yeah. So, I think we, for me, I think it's a matter of taking some time to myself once in a while. I used to drop my kids off, and when we were doing classes at the gym in person, I would go to bar class, and it was just what I did a couple times a week. And it allowed me to kind of have some time for myself, kind of amidst from the crazy, away from the midst of craziness of home and kids and everything, and just do what I needed to do for myself, So we can do that virtually now. It's not quite the same as doing it in person, but, so I think it's taking that time for yourself, even if it's not very much, to know that there's a little bit of time carved out for yourself. And to me, I think making sure that my family and the people are well taken care of and that they're happy also, relieves my stress to some degree, right? So it's kind of like incorporating some of those activities into my life that I know brings happiness to me, because it brings happiness to the people that I care about.
Yeah, if your children are happy, Typically, you're happy too, right? Yeah, it was interesting last week when we had the ice storm here, and I live in Portland, and Providence is in 7 states, and we have 55 hospitals, and Lori and I both work out of the Portland area, but we had a big ice storm here. We didn't get much, it wasn't as much as Texas, so we were really in the news with that, but I had to move in with my daughter because my power was out for a whole week, and she has 3 tiny children, and I just, oh my gosh, brought me back, and I just realized, we need to support each other women. Give people an hour break if you can, if you have a daughter, or your mom is really busy taking care of your father or whatever. Go and give them an hour break, take a walk so they can get some time to themselves. It's really hard right now where we can't take our kids to a class or get some outside help. So I think that's really important for just mental health and for heart health as well. So Lori, tell us a little bit about the programs that we have available for women in Providence.
So, we have both clinical programs, we have our research program, we have our community programs. But the Women's Heart Program really strives to provide comprehensive care in terms of screening and diagnosis of heart disease in women. And also, we have a special expertise in treating kind of specific cardiac syndromes that are more common in women. So, in addition to coronary artery disease, which is essentially plaque buildup in the arteries, it's by far the most common cause of heart attacks in women. There are also other syndromes that we see, and we have special expertise in that area. One of the things I mentioned in terms of our research interests is the spontaneous coronary artery dissection, SCAD. It's a type of heart disease where it's a heart attack that you get from a tear in the arteries of the heart. So it's not from plaque buildup, happens more commonly in young women. It's the most common type of heart attack that happens in pregnant women or women who've recently delivered. And it's a tear in the arteries of the heart. Well, it's not that it's a harder disease to manage. It's harder to diagnose. And you kind of need people who kind of treat this more on a more common basis to be able to manage it well. So we have programs like that. We also, there's a lot of different heart conditions that we see more commonly in women that require that special expertise. Stress cardiomyopathy, it's also known as broken heart syndrome, is the type of heart attack or heart failure that happens more in women, usually related to some sort of big physiologic or physical stressor. I had a woman who had this type of heart attack after she found out that her college-age son had drowned in the swimming pool. So it's a different type of heart attack. You have to manage it differently. People do differently, based on the management. So I think that, there are a lot of conditions that are more specific to women, that having that expertise in terms of a group of providers that see these things more commonly and have extra training in this area is important. But in addition to the clinical program, we have these great research programs, including the clinical registries, in terms of helping us understand how to take care of women with heart disease more effectively. And, these programs allow us to kind of broaden our understanding and provide better care. We also have these great community education programs. We talked about the Women's Tea and Talk that I do once a month. We're looking forward to, as the pandemic lifts and the restrictions lift, to offer kind of women's health fairs and women's heart screenings here at Providence and in the community, where we can go out and we can screen women and help them figure out what their numbers are, where they should be, and give them some tools to really help them improve their numbers and decrease their cardiac risk. At the end of the day, women these days, we have many roles outside of the home, but we still play the biggest role really inside our home, despite everything else that we do. We pack our kids' lunches, we make the doctor's appointments for our parents. We do all these things that are still very important in the home, even though we have a lot of responsibilities outside of the home. So if you give women the tools and the knowledge to live a heart healthy life, you're not just going to improve her health, you're really going to improve the health of her family and the community around her. So I think that these initiatives that we have coming up here at Providence in terms of community programs will be far reaching, and it will allow us to reach our community. One of the things that I've always found has been very interesting is that how you do in terms of your heart health has more to do with your area code and less to do with your genetics. Yeah. Meaning that, your genetics, your heredity plays a role, but really, because heart disease is a lifestyle disease for a lot of people, or at least 80% of the time, if we can help people live well, if we can reach these groups that are at, underprivileged kind kind of more socioeconomic groups, you can actually make, tremendous headway in terms of decreasing heart disease in the population overall. There are a lot of educational opportunities that happen early. We know that women who have gestational diabetes or have preeclampsia, in their 20s and 30s, well, 30 years later, they're the ones that come in with heart attacks.
Oh,
They're the
interesting.
ones with heart disease, so we already can identify these people way early. And we really should use this opportunity to educate them, to empower them with tools that we know will change their lives. And I think that the programs we have at Base Camp are unique for that purpose. We really allow this to be an accessible, prevention and wellness to be an accessible opportunity for people.
So, Lori, do a lot of women not realize that they have heart disease? And what would be, I mean, I know that people that regularly go to the doctor have all their numbers checked. That's probably few and far between, right? It's like you realize, oh, I haven't been to the doctor in 3 years because you've been feeling well. So what would people recognize as a sign of a heart attack or a stroke or, something to do with heart health? What are the signs?
Yeah, I think it's a great question. But I would say if there's any sort of discomfort in the chest, burning, pressure, tightness, abnormal sensation, especially if it gets worse with physical activity, you want to pay attention to it. Sometimes chest pain symptoms radiate and they manifest in other places. So if you're getting pain down your arm, in your shoulder, in your jaw, I've had women go to the dentist and say, I keep getting jaw pain, but they don't find anything wrong with their teeth. And if you ask her later, it's like, well, yeah, it's when I go up the stairs, I get this jaw ache, or it's when I'm on the treadmill, I get this pain in my jaw and my teeth. So sometimes pain goes to different places, and it's called referred pain. It can manifest differently. But if you're getting discomfort that gets worse with exertional activity or exercise, that's something not quite right, and that needs to be evaluated. If you're getting significant shortness of breath, where you're having to stop and gasp and, stop and rest in between things when 6 months ago that wasn't true for you, that's something to pay attention to. If you're getting severe episodes of palpitations, where your heart is racing, you're getting really faint and dizzy, where you feel like you might pass out, you're getting a lot of swelling in your legs, sometimes that's a sign of fluid retention from heart failure. So I think that if any of these things are occurring, then you should, talk to your doctor, get evaluated. When you talk about how do we know if we have heart disease, well, I'm going to talk about a couple kind of screening tips. In addition to knowing your numbers, if you're interested in kind of assessing your cardiac risk in terms of blockage issues and things like that, what we want to know is whether you have signs of silent heart disease. And, sometimes that's hard to come by. If it's silent, you're not having any symptoms yet. But if you've got a family history, if you've got high cholesterol, it might be worthwhile to talk to your doctor about doing something called a coronary calcium scan. It's a quick little CAT scan, about 3 minutes from here to here, and it just looks at how much hardened plaque buildup is in the arteries of your heart. And it can give you a percentile based on age and gender, kind of what your risk is, what percentile you range in. And it might tell you that, you've got an average amount of plaque for someone in your age group, which means we've got to really work hard to prevent that from getting worse. It may involve medications. It may tell you that, gosh, your cholesterol's been a little high, but you've got no plaque buildup that we can tell, at least no hardened plaque buildup. You can continue to work on diet and exercise. But sometimes, I get these patients that are like 45, they run marathons, they're ultra healthy, but they say, well, my dad had a heart attack at, 48. So what should I do differently? And I screen them, and they've got, really high amount of calcified plaque already in their arteries of their heart. And if that's the case, then we're going to treat this person much more aggressively, much earlier, with probably statin medicines to decrease plaque buildup, maybe an aspirin if indicated. So I think that there are kind of tools that we can use. If you're really paying attention and looking for it, you might be able to find and diagnose somebody's heart disease when it's still silent, because you can probably prevent it from ever becoming symptomatic heart disease.
Here. Well, Lori, thank you. My goodness, so much information. And I think the lesson I'm taking away from this is really pay attention to your body and take care of yourself, or you can't take care of anybody else, and really look for those warning signs and go to our website. We have some our website screening on the bottom of our screen right now. So please check out all the classes and things that we have. And just really want to thank you, Lori, for the time today. And thanks to everybody that will tune in, or we'll tune in later when you're done working tonight. And if you have any questions for us, put them in the chat and we'll get back to you as we can. And to learn more about our initiatives, programs, and services and ways to give, please visit us at providence.org. And in giving, we've had so many amazing donations, especially from Phil and Penny Knight for the Heart Institute. They've given over $100 million over the past, I think, 7 years, and it's made an incredible difference in the number of services that we're able to provide. So really thanks to the Knight family for their incredible generosity at Providence. And please make sure to follow us on social media, Providence Health System, and LinkedIn and Facebook and Instagram, and under Providence and Twitter. So that's it for today. Thanks, everybody. Take good care of yourselves, and we'll see you next time.
Thank you.
Bye. Thanks, Lori.
Thank you.